Intro to Online Learning, Navigating Next Steps in Healthcare Careers. All of this in 3 weeks. This entry course can lead students to healthcare jobs in environmental services or to a nursing assistant program. Want to keep learning? Ready to explore more options? You can earn a nursing assistant certificate. The NAC program is only 7 weeks. You will earn your NAC certificate and you will be trained in CPR and bloodborne pathogen safety. You'll also start medical-centered math and medical terminology and participate in clinicals. When you're done, you can start work as a nursing assistant. Many Washington employers are hiring NACs, and you can start work now. Or take the next step. Join the Medical Assistant Apprenticeship and earn while you learn. Healthcare apprenticeships are a new and growing occupational choice, and many of the hospitals we work with are building apprenticeship programs. We can point you in the right direction to get started on your healthcare apprenticeship. Right now, Washington hospitals are planning for programs for medical assistants, farm techs, and sterile processing. Maybe one of these options is the right one for you. Talk to us today, and we can help get you started on a unique journey into a rewarding healthcare career.
Okay, that's our video. I'm going to turn it over to my colleague Shelley now, who can walk you through some of the more specifics of our programming.
Great, thank you, Kelly. What a great video. I love the animation. How many of you guys enjoyed the video? Give me a thumbs up with your reactions there in the Zoom chat reactions if you're able to. Awesome, thank you so much. Well, as Kelly said, what I'm going to do now is give you some insight in terms of the programs that we offer. And so let me get my screen shared here. Just bear with me 1 second. Alrighty. So as Kelly mentioned, we are with the Healthcare Apprenticeship Consortium, and the Healthcare Apprenticeship Consortium, it is sponsored by the SEIU Healthcare 1199 Northwest Multi-Employer Training Fund. And basically what the Healthcare Apprenticeship Consortium is, it's partners with major healthcare employers all throughout the state, the labor unions, and the consortium works with individual partners to try and grow the healthcare industry, especially with entry-level healthcare jobs. These are some of our main partners that we work with. Some of them may look very familiar to you: Multicare, Kaiser, the Healthcare Apprenticeship Consortium. The apprenticeships are registered through the LNI, Labor and Industries, and that's really important because we are a legitimate program and we have very specific requirements, and you always want to make sure that you're in a program that is registered. The other thing about our nursing assistant certified program, it is registered, or it has been taken through all of the requirements of the Nursing Commission. But we partner with some of the major employers here within the state, some of which already have apprenticeship programs, and some of which we're working with currently to establish apprenticeship programs. So I'm going to talk to you about 3 different programs or options that we offer. The first is one that we refer to as our IHAP Healthcare Foundations program. That is offered through one of our community partners called the Seattle Job Initiative. And there, it's more about preparing you to be ready for a job and making sure you have good digital literacy skills. A certificate that you gain through that program is your CPR certification. And it really talks to you about introductory healthcare careers. At the end of the program, though, you do have an opportunity to interview for positions within the healthcare, one of which is the environmental services position, as well as a patient sitter. Another program that we have is that leads to what is the nursing assistant certificate, and that is offered through our program, and we partner with Clover Park. Because in this program, you're actually earning college credit. And in this program, you also have the opportunity to get your CPR certification. It's a lot more intense because it's 4 to 6 weeks And you also have to do a round of clinicals working 40 hours. There, after you finish your NAC certification, you have the opportunity to work in an acute health environment as well as long-term care facility. And the last box there refers to us as healthcare apprenticeships, because we do have apprenticeships for medical assistant, farm tech, and sterile processing. It really depends on the employer. And so for those programs, there are very specific requirements as well as our requirements and what the employer requires. A lot of times the employer already has a pipeline that they are considering. And so we really sometimes have to wait to see if they will accept external candidates. And so in that program, though, you do learn a lot about e-learning. You also get exposure to working with a multi-level clinical team, as well as having a mentor part of the apprenticeship. So I just wanted to go through some of the eligibility requirements for the program. IHAP, which is an introduction to healthcare professions. You have to be 18 years or older, have your GED, and be a Seattle resident. Basic computer skills are necessary. You also have to be able to work within the US with sponsorship. You have to be above an ESL level 5, and that just means you have to have completed at least your high school English class. You have to have the ability to pass a background check, work at least 16 hours a week, and be committed to being drug-free. All of our programs have great support systems built in. When you're part of the IHAP program, you do receive a weekly stipend of $125. You also get stress management coaching as part of the program, as well as a case manager that helps you and supports you in your time during the program. As I mentioned earlier, IHAP does give you an opportunity to move into a role as a patient sitter or into the environmental services environment. And so here, if you haven't ever heard of a patient sitter, it's a 1-year commitment on a job. What you're doing there is you're providing assistance to the nursing staff, and you're helping with things such as helping the patient with bed mobility, transferring them from the bed. You're working hand in hand with the professional nursing staff, and you're observing patients. And you perform some non-technical tasks, but they're really under the direction and supervision of the staff there. You're not by yourself. You also are just making sure you're providing a very clean and safe environment for the patient. And within the EVS role, you're responsible for cleaning and stocking supplies. You do use the computer to record work and update patient records, and you do interact with visitors and patients as well as the staff. Now, with our nursing assistant certified program, in order to participate, the eligibility requirements you can be 17 years of age, working towards your high school diploma or GED. You do need to be at least at a English level 5, and again, that means completing at least your high school English. In the nursing assistant role, it's really important that you have up-to-date vaccination records because you will be doing a clinical within a long-term care facility or a hospital. And so you must have up-to-date vaccinations. You have to have a background check performed, as well as be able to work within the US without sponsorship. If you participate in the IHAP program, that first program we talked about, then you become eligible to participate in the NAC program. It's not a requirement. It's just that if you do participate in IHAP, you get to become eligible for the NAC program. This program also offers a stipend. It is not a stipend for every week. For the first 4 weeks when you're in class, you receive a stipend, and then you take a break on your 5th week, and then when you go out for your clinical, when you're working the 40-hour work week, you are provided a stipend. Within the NAC program, because you're preparing to pass a national exam, we do provide you with a tutor throughout the 4-week program. And then we also provide you with someone to help with test preparation, because with the nursing assistant certified role, you must pass a skills test as well as a written test. And so being a part of the program, we prepare you for the test and provide you with additional support as well. Here's a little bit of a job description of a nursing assistant certified. You're providing patient care, part of the registered nursing team, and you're assisting with things such as changing beds, daily living activities. You're taking vitals. That's a big part of the nursing assistant program. We have a cohort right that just finished, and boy oh boy, they have to work really hard to know how to take a blood pressure and do a radial pulse. It's really important. And so you're doing things related to catheter care, helping and assisting the patient to the bathroom, bedpans, as well as feeding. Now, lastly, we do have what we call the Medical Assistant Apprenticeship. And to be eligible for this program, you have to be 18 years of older. You must have your high school diploma or GED. You also must demonstrate that you are ready to enter into community college level courses, English 098 and Math 087. Not quite what's required for English 101, but just ready to go into this math and English. You have to have basic computer skills, be able to pass a background check. Because our medical assistant program apprenticeship is directly working with a specific employer, they may have additional requirements that you have to fulfill. It really depends on the employer, and you also have to be committed to being drug-free. A lot of times, students want to know, how long does it take to get through the program? Medical assistant, it's really long. It's over 2,000 hours of on-the-job training and 288 hours within the classroom. So it takes about 15 months to complete. The nursing assistant certified can be completed, as I mentioned, 4 weeks of in-classroom learning, and then a week of clinicals. And so that can be completed in 6 weeks. And the IHAP program is 3 weeks. So we just wanted to take this opportunity to tell you about a little bit about who we are and the types of programs that we work with students in getting into. And there's myself and my counterpart, Mark Buffet. We are a team that works together, and we partner with employers as well as students, school districts. And what we'd like to do is encourage you to get on our email list so that we can follow up with you, because we hold information sessions where we go into a lot more detail about the specifics of each program. And we'd like to follow up and get you on our email list so we can invite you to those information sessions. One of the biggest things I can impart to you today is when it comes to apprenticeships, because some of our partners already have their programs going, one thing to help you get your foot in the door is to look for jobs with our partnering hospitals, Multicare, Swedish, Kaiser. Because once you're in, what happens with apprenticeships is that it allows you to have first priority in participating. The major hospital, for instance, Kaiser, that we have an apprenticeship with currently, their apprenticeship is designed to grow for individuals already working for Kaiser and to help them grow within the organization. And then they decide when and if they will open the opportunity up to external candidates. So a lot of times it's just beneficial to have your foot in the door. And so if healthcare apprenticeships is something you're interested in, I would really highly encourage you to look for a job with a major hospital. That way you have your foot in the door. And this here is my email. Please write that down. And I'm also going to put in the chat a link to a Google form, which will allow you to fill in your information so that we can have your email if you're willing to provide us with your email. Because like I mentioned earlier, we'd really like to follow up with you and keep you informed as we grow as an organization in making more apprenticeship opportunities available.